Pump Main, if ever kung may mga announcements po tayo before tayo mag-start. Ma'am, may announcements po ba? May I request also for the participants, please turn on your videos muna para at least na this will be a getting to know face din po natin. And then we can actually check for the internet connections din po natin. And para ma-judge po natin yung ano natin, yung mga binabayaran po natin monthly for the internet po natin. Good morning po. Good morning, doctors and nurses na all over Philippines. And I'm Mark Adlawan, na I'll be your instructor po for the BLS ACES and for the phlebotomy. And so for today, our focus will be more on the BLS for the basic life support. And may I know po, can you show some reactions or heart reactions for those who are physicians here? Yung physicians po natin. Ayan, heart reaction muna po. Ayun, mga physicians po natin. Ayan, si Doc John Batong at saka si Doc Gian Yu. Tama po ba? Ayan. And of course, nasa ating mga co-nurses din. Ayan, no? For the doctors and nurses na mga legit na mga frontliners, tama po ba? Of course, na syempre, na nasa hospital ngayon, yung iba, and they're still battling na for the COVID natin na journey po, na, or na battle. Okay, so let's begin now. So today, guys, we'll be discussing more of the BLS. So that will be our focus. And then on the next Sunday po, ayan, combination na po ng ACLS po natin and your BLS. Now, to begin with, welcome to We Pump Training Center, the #1 American Safety and Health Institute, the training center, ayan, all over the Philippines po. We usually conduct, whether if it's national or international po ng mga trainings. Now, if ever naman, kung medyo pumapangit po yung internet nyo, walang problema sa akin if i-off nyo yung camera nyo. Ang importante, you're there na to listen. And then, kasi later po, we will be administering na post-test. Pero if kaya naman po ng internet po natin, no? Ba't naman po natin i-off yung cameras po natin, right? Or your videos, okay? Ayan, sige. So let's have the kinds of life support. Now, today, guys, our focus will be the first kind of life support. So we have the life, okay, supports. When we say, okay, life supports, we have the 3 kinds, okay, of life supports. #1, we have the BLS. Next, we have the ACLS. Next, we have the PC, ayan, AC. When I say BLS, that stands for what? Basic, ayan, life, and support po. At sinabi po nating basic, guys, this usually happens, okay, on a pre-hospital setting. When we say pre-hospital, and that usually happens, okay, before, okay, dadalhin po ang client hospital sa isang emergency room. Pwedeng nangyari yung emergency po natin, pwedeng sa eskwelahan, pwedeng sa restaurants, pwedeng sa mga malls, sa mga beaches, di ba? Or sa mga sites. Nangyayari po at nabibidyohan po yan. So ano ba ang kalaban? As a frontliner po, usually ang kalaban po natin, syempre aside sa mga chismosang kapitbahay, na yung mga videos po. Di ba pag nakunan tayo ng mga videos, mababash po tayo agad. So the purpose of this training, guys, hindi lamang siya purely lecture, but rather I'll be showing you some of the videos na we need to follow na based on protocols. And right now po, since we are ASHI, we are following the American Heart Association, okay, 2020 guidelines, the most updated guidelines. And I will be presenting also later kung ano yung nangyayari ngayon sa COVID po. Kasi we're going to balance everything. Kasi 'di ba, di porket nagbi-BLS ka ay makakalimutan mo na yung mga protocols against COVID. Na just a friendly reminder po na based on John Hopkins kasi, and as of today as of 6:20 kanina po, ayan, Happy Mother's Day sa lahat po ng mga mothers natin and sa mga mothers po na participants po natin, whether okay, buhay, ayan, or kung nasaan man sila ngayon. Ayan, Happy Mother's Day po sa inyo. And I'm really happy na despite na Mother's Day po nag-join pa rin tayo ng training na ayan, sige lang, don't worry kasi may mga moments po na magbi-break tayo, 'di ba? If ever kung may mga celebrations, kayo walang problema sa akin. Yeah, this is a recorded po. Yes, recorded ng ano ng We Pump. So if ever kung pawala-wala yung internet connection nyo, don't worry kasi pwede kayong mag-ask na for the ano for the record po ng ating BLS na ng mga topics po natin. Okay. Sige. So, ganito. Let me let me share lang na based on John Hopkins kasi my goal na of this training po is for us to be updated din na with the current issues na nangyayari po ngayon. Let's say for the John Hopkins kasi as of May 9, which is ngayon, 6:20 a.m. Guys all over the globe na po na yeah, na it's already 1 million, 'di ba? Yeah. 157 million na po, 216,398. So grabe no? Ang world kaya yeah, global case po ng COVID po natin. And then for the Philippines alone, pero syempre kung globe kasi, global po, nangunguna pa rin sa death si US, to be followed by Brazil, at humahabol na po ang India. Ang bilis pong humabol ng India. Parang nakipag-compete ang India. Ayan. And then for the Philippine setting naman po, ang global case po natin is already nasa 1 million na po, 94 thousand. Ayan, 849. And then yung total deaths na po as of May 9, ayan, 6:20 a.m. Philippines 18,269. Ayan, so dumarami nga. Here in Davao, actually guys, Cebu IBT. And then nung wala pa pong COVID, nandyan din ako sa Bicol. And palagi ako nasa Bicol na for almost 1 year din ako nagstay diyan. Nandyan kasi yung ex ko, Char. Sige po. So pero naghiwalay na po kami na para buti na lang at least, 'di ba? Hindi ako sa maling tao, Char. We have the BLS. And so shout out na lang kay Doc Char. We have the BLS. Now, aside from the BLS guys, which is on a pre-hospital setting, we have the ACLS. Pag sinabi po nating ACLS, okay, that means Advanced Cardiac Life Support. Ayan, the advanced. Ayan, okay, vascular. Ayan, life support po. Pag sinabi natin okay, advanced cardiovascular life support, this usually okay on an intra-hospital setting na po. At pag sinabi po natin intra-hospital setting guys, sa loob ng hospital na siya. So this is a combination ng mga drugs po natin, 'di ba? Ng mga meds po natin, ng mga intubation po natin, na especially when we say intubation kasi, of course na ngayon sa mga sa mga bag valve mask, if you're familiar, commonly known as the ambu bag, di ba, we usually address that one properly. It should be BVM or bag valve mask. May ginagamit kasi tayong specific na filter ngayon known as the HEPA filter. And madidiscuss din siya later. The high efficiency na yung mga natin, na yung mga purifier or purified na air, no, yung mga HEPA filter po natin. Although madidiscuss naman siya later talaga. Okay? Next, we have the PCAC. Pag sinabi po natin, okay, PCAC, that means, okay, post-cardiac. Wait lang, gagamit na siguro ako ng white. Ayan. Kasi parang hindi siya masyado clear. Post-cardiac. Ayan, arrest care. When we say post-cardiac arrest care po, and this means okay, a care na after a cardiac arrest. Why? Kasi usually guys, no, after a cardiac arrest, nagugulay kasi ang patient pag hindi po talaga siya nadadala immediately sa hospital or nabibigyan po ng proper care, 'di ba, or management. So yun talaga yung goal natin at hindi magulay ang clients. Pero careful tayo okay, upon using the word magulay. Kasi 'di ba we have friends po no, iba po yung pagkaintindi nila sa word na nagulay. Kasi may friend ako dati na aksidente talaga siya na, and then nagtanong ang friend ko, "Mark, ano nangyari sa kanya?" Sabi ko nagulay siya na for almost 1 month. Tapos sabi ng friend ko, "Ha? Grabe gulay lang, walang prutas, walang karne, no?" So grabe, 'di ba? So careful po tayo sa mga words po natin. Although tayo kasi alam talaga natin yung mga words na yon, no? Pero for some na hindi po sa medical field, medyo struggle po sa kanila ang mga terms po natin. Pero pag sinabi natin na gulay, malamang na stroke si client. Okay po? Ayan. So again, we have the three kinds of life support. We have the BLS, we have the ACLS, and then we have the PCAC. Pag sinabi po nating PCAC, that stands for Post-Cardiac Arrest Care. Alright? Sige nga, i-check nga natin yung internet po natin, guys. Ayan, you unmute muna yourselves po. Ayan, you press muna yung mic po natin at the lower, okay, ayan, lower right ba to? Yeah, right ng screen po natin na sa part niya, ha. Ayan, sige. Ayan, everybody say BLS.
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 Ayan.
BLS.
Ayan, sige nga, check natin. Everybody say ACLS.
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 Ayan. So meaning maganda nga yung mic natin. And dahan-dahan kasi natin natutunan, no, yung mga online platform. Kasi feeling ko medyo magtatagal pa ang online platform. Right now, guys, na I'm affiliated sa isang school dito sa Davao. I work as a clinical instructor. But then again, yung training po namin, okay, especially for the BLS, for the ACLS, walang problema. Kasi every now and then, ayan, nagpapaano pa rin kami. Like, na syempre, ini-improve mo pa rin yung self mo, di ba? Nag-attend ka pa rin ng mga seminar, ng mga international seminars para may gather at may conduct din namin po sa aming mga estudyante. Okay? Ayan, sige. So, I'm more of the academe part. Ayan. Although kasi the training po natin, if ever kung you want the training, the actual, pwede naman po, no? Pag na-okay na si COVID, kasi ang dami kasi protocols, no? Ayan, papayag ba kayo if ever kung mag-gather tayo tapos kailangan mo nang i-swab? Di ba ang mahal naman ng training na yon? Kailangan pa talaga mag-swab, na siguro pag na-okay na po lahat. Alright? Ayan, sige. So we have the kinds of life support. Now let's begin. Now, we have I have a first question here. I have a question. What do you mean by emergency? What's the best definition of emergency? So basically, if that possesses a threat, guys, if that is a threat to your life, to your health, of course, involving you, involving your family, involving the whole community, then that's basically the definition of what? Emergency. 'Di ba? Pag sinabi nating emergency kasi na of course that means accident din, 'di ba? Pwedeng fire, no? Pwedeng mga force majeure po natin by forces of nature, right? Pwedeng trauma cases na in which the number one common trauma cases here in the Philippines will be the motor vehicular accident, particularly sa mga motor talaga, na in which nakakatakot po. Okay? With VPOM Training Center, we also conduct po trauma life support. Ayan, so keep updated and then keep posted also. Ang dami pa namin mga trainings po. Ayan, sige. So we have read the what? The definition of the word emergency. Now, as a medical frontliner, and you have to choose isa lang. Whether you're going to choose life over death or death over life. So depende din 'yan sa client natin kung lalaban ba talaga ang client natin. Pero mostly naman sa client natin takot mamatay, 'di ba? Kasi ganito 'yan na in life kasi if ever kung hindi ka talaga takot mamatay, you are actually selfish na kasi hindi mo iniisip yung mga taong may iwan mo na like baka ma-depress sila or forever silang maglulong sa love and affection mo. Kaya usually when I ask na a person, takot ka bang mamatay? If the answer is yes, meaning to say na andun yung 'di ba yung fear niya na sad ang family niya. Pero may mga moments talaga na parang gusto mo na din na siguro kasi you are mentally 'di ba? Unhealthy sa mga pinagdadaanan po natin ngayon. I hope sa pinagdadaanan po natin ngayon, ang dami kasi talaga nawala ng trabaho. 'Di ba? Like, for the medical frontliner, syempre, hindi tayo nawala ng trabaho, but rather, mas nadagdagan pa yung workload po natin. Na, ako, honestly, na-miss ko talaga mag-travel. As a reviewer kasi, I love to travel. As a trainer also, I love to travel. Pero ngayon po, since online, as in like makakatakot, like nakaupo ka lang, 'di ba? Tas kailangan mong gumalaw-galaw, 'di ba, para hindi pumanaw, no? So, DVT or the deep vein thrombosis is really common, no? Sa ating mga ginagawa. Lalo na as a clinical instructor, always po kami naka-online, no? Ayun po, no? So again, as frontliners, as responsible frontliners, kailangan po we need to choose okay, life dapat. Kailangan po nating maitawid ang ating pasyente. Tama po? 'Di ba we always say this to our client, "Ma'am, itatawid ka po namin na sa bingit ng kamatayan." And that's an ideal na you're a nurse na with a heart, 'di ba? The heart to care, 'di ba? And of course, the heart to serve din. Love serves, ika nga. Yan din yung motto talaga namin eh. Ayan. So aside from your okay, choosing okay, yeah, life na over death, kaya nga i-training po natin na we need to emphasize no more of the high quality chest compression or HQCPR. Now for today po, it's not a CPR alone but rather okay, it should be high quality CPR. Kasi upon okay, using the word okay, high quality CPR, that only means na you are following the standards, you are following the principles, and you are following the protocols po that is expected na from you, expected of you, 'di ba? Ayan, so let ayan, the basic lab support. Now, for the basic lab support kasi, ayan, syempre, na as shown sa picture po natin, we have a combination of the high quality chest compression and then we have okay, wait lang, ba't parang naghang ako? Wait lang guys ha, naghang ata ako. Hindi nag-move yung slides ko. Wait lang po, wait lang. Wait lang ha, nag-ano lang siya, naghang lang siya. Ma'am, medyo po ganun talaga pag mga nasa mga approaching 9 o'clock na medyo ang pangit lang. Sorry, sorry. And can you still hear me ba? Can you still hear me pa?
Yes.
Ririnig pa rin po ba ako? Ayan, thank you po. Wait lang ha. I-ano ko lang, i-fix ko lang 'to. Nagko-connect pa kasi yung isang gadget eh. For a while lang po. Talaga yung ano, lately yung internet dito sa Davao. Parang gusto ko nang bumalik ng Manila din. For a thing po. Ma'am, pa-accept ako ma'am ng isang ano, waiting ata siya. We pump main, pa-accept na lang po. Wait lang guys, tawagan ko sila. For a while lang po. We pump main, ma'am. Okay. And sorry for the interruption guys na medyo expected talaga pag mga ganon na yung mga online platform po natin. Ayan. As long as makabalik po tayo sa ating internet na so okay na 'yan. So ayun. Ito yung gustong ipakita kanina sana na so we have the high quality chest compression there. And then we have the AED known as the automated external defibrillator na so kailangan kasi na best combo po tayo. Tulad ng mga load guys, iba may mga combo-combo ang load. Now, tulad din, okay, sa high quality chest compression, kailangan talaga siya, okay, packed na. Ayan, so combo pack talaga siya. May high quality chest compression, tapos dapat din na may okay, early defibrillation din tayo with the use of your automated external okay, defibrillator. All right? Ayan, so again, we have here the AED or this is actually a walking and talking din na device. Kasi sasabihin niya later, ayan, shock advice or no shock advice. When we say shock advice, those are your shockable rhythms. Pag no shock advice, mga non-shockable rhythms po natin. Now, to begin with your okay, high quality chest compression, we usually have the so-called term known as the BSI or the body substance isolation, commonly known as the PPEs po natin. Diba? The personal protective equipment or the personal protective devices known as your PPE. Next, known as the PPDs also. The personal devices, ayan na, or the PPE natin or BSI. The same lang yan with the use of your gloves, na, your mask, your goggles, your face shields po, na, your gowns din. And especially no, yung mga mask po natin, that's basically the N95 mask, no? Para mas maganda talaga yung filter doon. Okay, and I hope na you're using the N95 mask na. Pero for some naman nagdo-double okay surgical mask sila, no? That's okay naman. Yung iba nga nagti-triple pa, yung iba nagko-quadruple pa po. So as long as you're protected, then walang problema 'yon. Now, let's discuss okay, the principles of high quality chest compression. Now, I will be using the American Heart Association 2020 guidelines. Now, sir, bakit 2020 guidelines? Na bakit hindi 2021? Kasi honestly po, every 5 years kasi si AHA na pero kasi ganito. Every day po, nag-update na sila, na. Pero bakit 2020? Kasi guys, 2020 talaga kasi yung pinaka-last na in-update nila. Pero every day may update sila, don't worry. Pero kasi yung updates po nila lately was regarding the stroke, no? Regarding healthy diet na to patients na nagkaroon ng stroke, in which ipapakita ko din yung video ng American Heart Association, don't worry. All right, so we have here the principles. Sige nga, sabay-sabay tayo. Everybody say principles.
Principles.
Ayan, thank you po. So we have here the principles of your HQCPR. Now, my principle for your HQCPR, guys, I have my own mnemonic known as the Pucha na mnemonic. Ayan. Sir, the same pa rin, no? Yung pucha po natin. If ever kung naging estudyante ka na kita before. Ayan. Letter P stands for what? Na you need to push hard and fast. Push hard. And then you need to push fast. Of a rate of at least, okay, 100 to 120 compressions, okay, per minute po. So we have, okay, ayan, no, push hard and fast of at least, it's at least 100 to 120 compressions per minute. Next, we have your letter U, unnecessary interruptions. Unnecessary, ayan, interruptions must be minimized. Must be, ayan, minimized to not more than 10 seconds. Not more than, ayan, 10 seconds po of at least na 5 seconds but not more than okay 10 seconds. Now sir, matanong ko lang, pag sinabi po nating unnecessary okay interruptions, what are they? Let's say natagalan ka na mag-analyze sa rhythm or let's say sa ECG. That is already a form of interruption. Aside from that, pag hindi ka marunong okay mag-apply ng tinatawag na AED or automated external defibrillator pag natagalan ka, it's already a form of interruption. Next, ano pa? Like unnecessary changing of the position of your client, na that's also a form of interruption. So guys, there should be no interruption, okay, for more than 10 seconds. All right. Now next, we have your letter C. Compression deafness must be adequate. Compression, ayan, deafness must be okay adequate po. Pag sinabi natin compression, okay, deafness, okay, must be okay adequate, guys. Now, always remember this, na we have okay 3 patients kasi talaga. According to AHA, ayan, 3 ang patient usually natin. We have an adult. Ayan, sulat natin. We have an adult here. We have a child. Ayan. And then we have the infant okay, patient po natin. Ulitin ko. We have the adult, okay, the child, and we have the infant patient. Now, when we say okay, adult patient, okay, gaano ba ka-deep dapat, sir? It should be okay for at least 2 inches, but not more than 2.4. But not okay more than 2.4 okay inches po. Next, okay, how about okay for the child? Pag child naman po, ayan, it should be, ayan, for about, okay, 2 inches dapat. Hindi naman po nila binago eh. Ang medyo bago lang sa inyo dito is your not more than 2.4 inches. Dati kasi guys, na 2015, it's at least 2 inches lang. Pero 2015, okay, and above, sabi nila, pwede na 2 inches, pero hindi ka pwedeng lumagpas ng 2.4. Baka mababali kasi ang ribs ng patient po natin. Next, we have here the infant, okay, client. For the infant naman, it should be okay about 1.5 inches. All right. So we have here the compression deafness, okay, must be okay adequate po. So we have here the adult client, we have here the child, then we have here the infant patient. Now, segue tayo ha. If that okay talks about okay compression deafness, okay, must be adequate, then we need to discuss also, no, kung ano ba yung compression to ventilation ratio. Yan. If ever kung nakopya na yan, mag-move ang slides ko. Ayan, eto. So we have the CVR. That means compression to ventilation ratio. Pag sinabi natin compression, okay, to ventilation, okay, ratio po, ayan, sir, ayan, normally po, ang ginagamit kasi natin, if you're familiar with 30:2, tapos 5 cycles, 30, this represents compression. 2, that represents, okay, ventilation. And then 5 is referring to cycles. And are you aware, pag sinabi po nating cycles, okay, that runs okay, for about at least 2 minutes. Kaya pag sinabi ng doktor, at least 2 minutes, then that means, okay, tapos na po ang 5 cycles po natin. Now, we have an adult client here. For the adult okay, patient, sir, yes, we are using the CAB, the circulation, airway, and breathing. So malalaman natin yan. Now, for the adult po, ayan, we have the 1 rescuer, and then we have the 2 rescuer approach. Still, dalawa, no, 30:2 for 5 okay, cycles. that should run for about no at least 2 minutes. Kaya pag sinabi ng doktor, 2 minutes up, okay doc, no? Ayan, ano po, 5 cycles of compression already completed. Aside from the adult patient, now we have here the child patient. Pag child naman po, still we are using the CAB, the circulation, airway, and then we have here the breathing. You have the one rescuer and then two rescuer approach. For the one rescuer approach, guys, it's still 30 so for 5 cycles. Pero pag two rescuer po, no, magiging, ayan, 15, ayan, is to 2 for 10, cycles. That's for the child. How about, pag infant po ang patient natin? Ayan, for a while. So we have here the infants. Pag infant, we have here the one rescuer, and then we have here the two rescuer approach. Pag infant po, one rescuer, yes, it's 30 is it so? For 5 cycles. Pero pag two rescuer approach na, magiging 15 is it so? Ayan, times 2 ang ating 5 cycles. So magiging 10 cycles. Alright? So again, ito po yung flow natin. We are still using the 30 is to 2 for 5 cycles, pero depende kay clients. The 30 is to 2 no, is to one rescuer and two rescuer approach for adults. For the child naman and infant, na one rescuer lang sila. Kasi pag two rescuers na po, magiging 15 is it so, 10 cycles. And then yung isa, 15 is it so, for 10 cycles din po. Okay? Ayan. So we are done na with your compression deftness. Must be adequate. Next, we have your letter H. Di ba? Para makompleto yung putya na mnemonic po natin. Letter H, stands for, has an obvious chest recoil, has an obvious, ayan, chest, ayan, recoil po. Pag sinabi po natin, obvious, chest recoil, there should be an obvious, chest rise and chest fall. Why? Now, normally, dapat may obvious chest rise and chest fall. Magiging abnormal yan if that's absent. And are you aware na if there will be the absence, of the what we call as the chest recoil, that only means na baka may rib fracture ang patient. This is a sign, of rib, ayan, fracture. Sir, delikado pa pag may rib fracture ang client? Yes. Kasi it will puncture the what? No, the lungs, causing tension pneumothorax. And di ba, if ever lang, no, kung conscious ang client, the patient will complain of sudden chest pain. Pero since unconscious naman ang client po natin, so hindi po siya makakaramdam ng pain. Kung ma-revive mo, edi after na. And then magulat ka, may mga tracheal deviation, absent breath sounds, na para masabi po natin na poof, na that's your tension pneumothorax. Alright? Na may kita po natin sa x-ray kasi may mga tracheal deviation. Pero usually, this is ang common symptom talaga nito, if in case lang na makakapagsalita ang client nyo, there will be sudden chest pain. Kasi na-puncture na yung lungs mo eh. And then after that, no, absent ng breath sounds ng stethoscope. And then pag pa-x-ray mo, shocks, bakit may tracheal deviation? Na ang trachea niya deviated to the right or to the left. Depende po kung saan po yung tinatawag na tension pneumothorax. Kasi kung papunta ang trachea mo sa left, meaning nasa right ang tension pneumothorax mo. Kung papunta naman sa right ang trachea mo, meaning nasa left ang tension pneumothorax po natin. So depende talaga sa area of origin po. Di ay gilodan. Ay, sorry. And may nabasa lang ako na text. So we have your the letter H. Next we have your the letter A. All right. Now, pag sinabi po natin, putya guys, na letter A, you need to avoid excessive ventilation. You avoid excessive ventilation po. Pag sinabi po natin, you avoid no excessive ventilation, then, sir, bakit kaya kailangan i-avoid ng excessive ventilation? I want you to encircle the word excessive ventilation. It causes two things po. Ayan, number one, alam niyo ba na excessive ventilation, it causes an increase intrathoracic pressure. Aside from increase intrathoracic pressure, it also causes an increase abdominal, abdominal, ayan, pressure po. So it increases intrathoracic pressure and it also increases intra-abdominal pressure. Now, how's that, sir? Now, anong nangyayari, sir? If there will be an increased intrathoracic pressure, guys, ayan, no? So iipitin po ng tinatawag na thoracic cavity mo or ng 'di ba, ng chest po natin, ng heart natin. So anong mangyayari? There will be a decrease venous return. Ayan, decreased venous return leading to decreased cardiac output, meaning papangit pa ang prognosis ng patient natin. Why? Brought about by the increased intrathoracic leading to decreased venous return or blood flow. So meaning decrease ang cardiac output mo, pangit ang circulation natin towards the systemic circulation. So pangit siya. So another problem. Now, how about kung may increase intra-abdominal pressure naman po tayo? Alam niyo ba guys na pag may increase intra-abdominal pressure po ang patient po natin, now anong nangyayari sir? There will be backflow. Ayan, there will be backflow. Sir, what happens kung may backflow? Okay, ang patient po natin. Then that leads to what? Na aspiration pneumonia. Aspiration pneumonia. When I attended a seminar sa UST, ang sabi doon, 75% mamamatay si patient. Only 25% mabubuhay ang client, especially for those na will be suffering from aspiration pneumonia. 'Di ba? This is a form of a chemical pneumonia kasi, 'di ba? Ayan, so if this is a form of chemical pneumonia, then ayan, no, yeah, it's really difficult to manage. Okay, patient po suffering from aspiration pneumonia. And then this is really common to the probable extremes. Pag sinabi po natin probable extremes, we have the too young and too old patients. Kaya nga sa mga mothers out there, if ever kung may anak kayo tas umiiyak, tas 'di ba kayo kasi or tayo, yeah, sorry pero yeah, nasi stereotype na generalize ko na din kasi Ayan. Pag umiiyak kasi ang bata, alam niyo ba ang reason behind that? That is already a late sign of hunger. Meaning, late sign na siya, meaning hindi mo nakita na gutom ang bata kanina. Kaya 'di ba, the way to communicate po is of course na syempre pag let's say mga newborn infant, that's to cry talaga, no? So, yeah, you already failed as a mother pag umiyak na po siya kasi somewhere na before siya umiyak, gutom na talaga siya. Last resort na po niya ang umiyak. And then tayo din, habang umiyak ang bata, tapos pinapadede mo, kaya biglang, di ba, naubo, tapos biglang na-aspirate. Kaya careful po tayo, guys. Na careful po. Okay? Ayan, sige. So, ayan, we are done now with your letter A. But wait, there's more. What if ganito po ang nangyari? I'll be giving you a situation. Situation goes like this. Present po ang pulse rate ng patient. Pero negative po ang RR ng patient. Anong gagawin natin? You perform rescue breathing. Okay po? Rescue breathing po ang gagawin po natin. Now, paano ba mag-rescue breathe? We have an adult patient. Next, we have a patient who was hooked to an advanced airway. Next on advanced airway, we have the child here. And then we have the infant also. Ulitin ko lang ha, we have the adult, with an advanced airway, we have the child, then we have the infant. Now, sir, may pulso ang patient po natin pero hindi po siya humihinga. So you perform rescue breathing. Siyempre with the use of the BVM. Guys, BVM stands for valve, the bag, the valve, and the mask. Bag, valve, mask. Ayan, for the adult patient po, paano ba mag-bag? May pulso naman ang patient no, pero hindi nga lang siya humihinga. There's no breathing. Possible kasi yon na may pulso pero hindi siya humihinga. Pero this one is impossible. Yung tipong wala nang ang pulso pero humihinga. Imposible yon, no? Pero possible po na may pulso ang patient pero hindi humihinga, respiratory arrest kasi ang tawag doon. Now, if ever kung may respiratory arrest si patient po, we can give the rescue breathing. By how? Ayan, no? By giving, di ba? By administering air via the bag, the valve, and the mask, or commonly known as the ambu bag. we don't address as okay ambu bag, na? We don't address it as ambu bag. Why? Kasi ambu bag kasi sa brand name and we don't promote brands here. Kasi ang ginagamit ng Pilipinas ay yung ano, yung disposable na from China. Pero te, hindi po siya dispose. Nire-reuse po siya, kaya ang weird. Well, Philippine problems na. Ayan, third world problem. So for the adult guys, we have the one rescue breath, meaning one bag. Ayan, ayan, 5 to 6, okay, seconds po. One rescue breath every 5 to 6 seconds. That's for the adult client. What if daw intubated ang client po natin? It's one rescue breath. Ayan, ayan, 6 to 8 seconds po. Now, that's for, okay, with an advanced airway. Na, next, we have ayan, itong child po natin. For the child naman, okay, we have the one rescue breath na every 3 to 5, okay, seconds po. The same din sa infant po natin, which is your one rescue breath every 3 to 5, okay, seconds din. The same lang si child and infant. Now, balikan natin yung discussion po natin. Guys, sabay-sabay tayo. Everybody say pucha. Pa-unmute muna po. Try natin ang mga internet natin. At kung narinig ko ba talaga kayo. Everybody say pucha.
Pucha.
Ayan. Thank you, ma'am. Thank you, ma'am Saitus. Na? Ayan. So, ayun. We have your letter P. Ano nga yung letter P? Push hard and push fast. Tama po. Next, your letter, okay, U. Unnecessary interruption must be minimized to not more than, okay, 10 seconds po. And aside from that, we have your letter C. Compression deafness must be adequate. We have your letter H. Has an obvious chest recoil. And lastly, we have your, okay, letter A. Avoid na excessive ventilation. Bakit nga ulit? Kasi pag na-excessive ventilation si client, dalawa ang mangyayari. Increase intrathoracic, increase intra-abdominal pressure. And I have already discussed to you kung ano ang mga consequences po natin if we tend to hyperoxygenate your client. Now, I'll be showing you a video on the discussions po na tinatawag na BLS. Na? Sige, for a while. And then right after my video, guys, magbe-break muna tayo. Kasi I usually have my break talaga na para hindi naman ma-stress yung iba sa mga internet connection po nila and the like. Listen carefully, full volume tayo. I-adjust nyo yung volume dyan. This is according to American Heart Association. Full volume.
The foundation for resuscitation of cardiac arrest patients is high-quality basic life support. It's critical that you successfully perform these skills because effective advanced cardiovascular life support depends on them. These skills help save lives. High-quality CPR maintains blood flow to vital organs, especially the heart and brain. The components of high-quality CPR include adequate compression depth. Remember to push hard, compressing at a depth of at least 2 inches. Make sure you position your body over the patient. Good body position, with the shoulders serving as the fulcrum over the chest, will help you use your own body weight to perform compressions. Consider a step stool if necessary to achieve this position. Adequate compression rate. It's important to push fast by compressing at a rate of 100 to 120 compressions per minute, allowing complete chest recoil between compressions. Minimizing interruptions in compressions. Healthcare providers must minimize interruptions in chest compressions. This includes any pauses to deliver ventilations. When healthcare providers interrupt chest compressions, coronary perfusion pressure decreases dramatically and remains very low until compressions are resumed. It takes several compressions to build enough pressure to achieve an adequate coronary perfusion pressure necessary to get ROSC. And finally, avoiding excessive ventilation. The AHA recommends the use of audio-visual feedback and prompt devices during a resuscitation attempt or during training for real-time monitoring of CPR quality. The first skill we'll demonstrate is combining 30 compressions with 2 ventilations.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Skills. We'll now illustrate two healthcare providers assessing and performing high-quality BLS, including the use of an AED.
The scene is safe. Are you okay? Are you okay? We need more help. Call for backup and bring the defib. No pulse. He's not breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Attach pads to patient's bare
One, two,
chest.
3, 4, 5, 6,
Plug in
7,
pads
8,
connector.
9, 10, 11, 12, 13, 14, 15, 16,
Analyzing
17, 18,
heart
Clear.
rhythm.
19.
Do not touch the patient. Shock needed. Charging. Stay clear of patient.
Clear.
Deliver shock now. Shock delivered.
1, 2, 3, 4, 5, 6, 7.
In summary, perform high-quality CPR by compressing at a depth of at least 2 inches and at a rate of 100 to 120 per minute, allowing complete chest recoil, minimizing interruptions and compressions, and avoiding excessive ventilation. Additional measures, such as switching compressors every 2 minutes or earlier if fatigued, and using audio and visual feedback devices to improve CPR quality in real time, will help give patients the best chance for survival.
Okay, guys. Now, Ma'am We Pump, maybe magbe-break muna tayo po. No? Let's have the break for about 20 minutes. Na? And then you refresh na your internet connections po. Okay, guys. Pwede kayong mag-leave muna. Ayan, magre-resume po tayo at exactly 9:15. Okay po? So 9:15 magre-resume tayo. Ma'am
Okay,
We
sir.
Pump.
Thank you.
Yes po. If ever kung may mga kayo, Ma'am We Pump, na may mga announcements po.
Okay po. Hello po. Paki-message po sa chat box yung full name niyo po na mag-a-appear po sa certificates.
Hello, Ma'am Joy. Ikaw pala yan.
Oh,
Ma'am
sir.
Joy, Happy Mother's
Thank
Day.
you po. Happy Mother's Day din po sa lahat ng mothers dito po. Kung gusto niyo pong lagyan ng title, yung names niyo po, pwede din po. And pakisend na rin po yung email niyo po. By the way po, dun sa mag-a-attend ng BLS and ACLS and phlebotomy, makaka-receive po kayo ng 9 certificates and 2 IDs. Ang inclusion lang po is digital copy of your certificates. If you want to avail po ng hard copy ng certificates and IDs plus the official receipt, pwede po kayong mag-avail. May additional lang pong 200 pesos. Free shipping na po yan. Sa mag-a-avail po, message nyo lang po yung coordinator and same payment method pa rin po. Sa mga magtatanong po kung kailan ma-release ang certificates, actually po talaga sinasend po namin yung certificates at the end of the training. So dapat next week. Pero dahil na-rescheduled po tayo ngayon kasi may hindi available ang instructors yesterday, pwede na namin po i-release ang certificates and IDs, digital copy today, pero dapat po fully paid. Message niyo lang po yung coordinator niya.
Introduction before we discuss defibrillation.
Let's start by learning how to perform cardioversion. Here's a patient I recently treated. He was 57 years old. He had palpitations. He had a normal blood pressure. He didn't have any chest pain or shortness of breath, but he was really uncomfortable. We assessed him to have atrial fibrillation with rapid ventricular response, and we confirmed it with an EKG. You can see that there are no P waves and the heart rate is pretty fast and irregular. Let's cardiovert him. After consenting the patient for sedation and cardioversion, place your pads and connect to the machine. Next, administer the sedative and wait until it takes effect. Since you're performing cardioversion, press the sync button. Then select the energy level and charge the machine. I recommend at least 100 joules in a biphasic machine for all rhythms. Depending on the size of a patient, I may just go up to 200 joules of biphasic energy. Once charged, make sure no one is touching the patient. As soon as everyone is clear, press the shock button. You'll see a brief contraction of the patient's chest wall muscles. And at this point, look at the monitor and see if you have terminated the dysrhythmia. After the cardioversion, the EKG is repeated and shows successful cardioversion to normal sinus rhythm. Because we used the short-acting sedative etomidate, our patient was awake and asymptomatic and ready for discharge within minutes of the cardioversion. Now let's look at the case that needs defibrillation. For defibrillation, there's no need for sedation, since the patient is unconscious and CPR is likely being performed. So select the highest energy and charge the machine. Once it's charged, make sure no one is touching the patient. This is the only time that CPR is briefly stopped. And as soon as everyone is clear, press the shock button. You'll see a brief contraction of the patient's chest wall muscles. Using the latest guidelines, continue CPR for 2 minutes before checking the rhythm again.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Med Mastery can help
Okay, let's continue now. Sorry. And so our next topic po, since we are done with the introduction of your BLS, so let's have the topic known as for the defibrillation. Okay. With your defibrillation kasi guys, now we have the shockable and non-shockable rhythm. The purpose of defibrillating the client is to stun the heart of the patient. Gugulatin po natin ang heart ng client natin. And then, now we can reset everything. Na yung electrical conduction ng heart, na etc. Now, when we say the defibrillation po, for the shockable rhythms, and then we have the shockable rhythms po. When we say shockable rhythm, guys, na kailangan pong i-shock si patient. Di ba? If we want to shock the patient po, then ano yung mga possible, let's say ECG, readings po. Number 1, we have the VFib or the ventricular fibrillation. Next, we have the pulseless VTAC or pulseless ventricular tachycardia. Yes, you heard me right. Kasi pag sinabi po nating VTAC, it may be with pulse or it can be without pulse. Ang delikado lang talaga sa VTAC, guys, ay pag wala na po siyang pulse. Kasi pag sinabi natin, nag-arrest na kasi ang patient natin dito. Pag sinabi naman natin, non-shockable, example po ng mga non-shockable natin, of course, nangunguna na si asystole, which is on an arrest setting, pero non-shockable siya. Next to asystole, guys, we have the PA. Diba PA stands for what? Pulseless electrical activity po. When we say pulseless electrical activity, it's the PEA or the PA. So once again, we have the shockable and then we have the non-shockable rhythm. And that talks about defibrillation. Now, when we say defibrillation, we have the phasic and we have the biphasic. Monophasic, and then we have the biphasic. These are actually the what we call as the waveforms. Ayan. Dalawa pang waveforms natin. Number one, we have our mono and then we have our the biphasic. Guys, pag monophasic po, na meaning one paddle lang ang magbibigay ng electrical charge, na one paddle, kaya it's mono. So one pad tayo, one pad. Pero pag biphasic po, two pads na yan. Two pads ang magbibigay. And then usually kasi pag monophasic malalaman natin, and are you aware na obsolete na po pag gagamit ka ng monophasic? Sobrang bawal na po yan. Kasi bakit kayo nagmo-monophasic? Meaning to say hindi kayo na-check na ng ng DOH na etc. Usually kasi pag monophasic, 360 ang maririnig mo eh. Pag sinabi ng doktor or ni doc, okay, please charge the patient to 360 joules. Na ay, okay, 360 pa. Sa monophasic to, hindi to na-check ng ng DOH. Pero pag sinabi ng doktor, okay, 150 joules, no, 150 and then 150, a total of 300, na that's your biphasic. Ay, okay, updated na po no ang defibrillator po namin. Congrats na to our hospital. And then malalaman mo kasi ang colors eh. Kasi pag monophasic yan guys, ang colors pa rin po will be the white, black, and red. Right side, left side. That's monophasic. Pero pag biphasic na po, updated na to, red, yellow, and green. Alright, so ito yung mga colors po natin. Pag monophasic, white, black, and red. Pero pag biphasic na po, it's red, yellow, and green. Yung mga electrodes natin guys yung mga nilalagay po natin, 'di ba yung sa ECG po natin, yung mga colors kasi yan. Pag white, black, red pa rin yung colors nyo, monophasic pa rin ang ginagamit nyo. Pero pag nag-red, yellow, and green na po kayo, congrats po, mayaman po ang hospital natin, biphasic na po siya. Now sir, bakit importante malaman ang biphasic at saka monophasic? Are you aware na pag monophasic kasi ang gamit, ang dami pong namamatay brought about by the burnt myocardial cells. Nasunog ang myocardial cells. Why? 360 ba naman automatic? Na susunog. So sabi ng American Heart Association as they perform yung mga, 'di ba, mga autopsy ng mga studies po, ayan, they have concluded na dapat biphasic lang para hindi masunog ang tinatawag na myocardial cells ng patient natin. So 150 and then 150. That's your biphasic. Pero pag 360, isahan agad na at the apex agad na ang tinatawag na 360 kaya sunog po ang heart natin. So never use monophasic but instead make use of the biphasic na defibrillator po natin. All right? Now, question, sir. Pag sinabi nating BLS guys, syempre it's a combination of high quality chest compression plus your plus your early defibrillation. Now my question is, when are we going to start high quality chest compression and when are we going to stop? Ayan, when ba mag-start? When din mag-stop ng high quality chest compression? So when are we going to start po? Number one, if the patient is unconscious. Aside sa unconscious guys, so we have the pulseless patient or the negative pulse. So we have the no breathing, patient po natin. Or it might be, yes, present po ang breathing, but only gasping. Ayan, yes, may breathing but only gasping. That's the agonal gasp. Diba? Pag sinabi natin agonal gasp, na ito din yung naririnig po natin sa mga mamamatay na po na clients, na that's the agonal gasping, na. And usually kasi yung agonal gasp po natin ay ma-observe po natin yan sa may mga motor vehicular accident. Like yung tipong look at me sa camera, biglang gaganon ang client guys Gaganon lang siya, na? O, di ba bagay? Charot. So we have the start, na? When are we going to start? Feel na feel di ba? So we have the unconscious patient, we have the pulseless, we have the no breathing, and then we have breathing but only gasping. Kamusta po ang weather sa Bicol? Balita ko may bagyo. May bagyo ba? The weather is gloomy ba? Ay hindi, sunny pala siya. It's sunny outside. Na I miss na the weather na sa Bicol. Pero hindi ko na-miss yung ex ko na doktor, Char. Sino ba dito ang mga taga BRT? Kaway-kaway. Sino ba dito ang mga taga Tanchuling? Charot lang. Naka-move on na po ako. Na part lang talaga siya ng story ko. Kasi kailangan ko siyang story. Na although naka-move on na ako kasi paano ako maka-move on, no? Lahat ng mga estudyante ko always from Bicol. Kasi marireminisce ko talaga, guys, yung mga kaganapan na nangyari sa akin sa Bicol, no? Lalo na sa may Camellia Homes. Yeah, ito ata yung month na umalis talaga ako. The moment na nag-lockdown kasi that time last year ba? No, last year, na. Yeah, last year hindi. Oh yeah, parang last year. Last year kasi kakaano lang namin. Yeah, na. So ayun po. I left na Bicol with a heavy heart, like sobrang heavy heart. The moment na nag-start yung lockdown, sabi ko talaga, ay hindi talaga to yung tao na makakasama ko talaga. Kasi lumalabas na yung mga ano, yung mga attitude namin and all, no? Kaya sabi ko, uwi na nga lang ako. Kaya I rented a van, no? Sabi, hindi ka pwede makakauwi kasi bawal. Sabi ko, hindi na kita love. So, kailangan ko nang umuwi. Ayun, guys. So, umuwi ako. I rented a van, no? Yeah, I spent almost 15,000 para ma-travel lang talaga ako, ha. So, private van. Ako lang mag-isa doon. Tapos, naglagay ako ng van paper sa harap ng van. Medical supply, ganon-ganon. Para makaalis lang talaga ng Bicol, no? Grabe yung pagsubok ko, guys. Siyempre, yung PRC kasi natin, doon ko na-appreciate yung PRC, lalo nung nasa Bicol ako, 'di ba? Priority tayo. Like sa mga malls na, like sa mga, 'di ba, groceries po, priority tayo. Pero well, may hangganan pala yung ano natin, no? Yung importance natin. Kasi ngayon wala na po tayo sa priority lane. Nakakasad. Bakit? Natapos na ba ang COVID? Tapos na ba ang laban? 'Di ba hindi pa, no? Kaya I hope na ibabalik pa rin nila yung ano, yung priority lane. Ma'am Sara, may priority lane pa rin ba for frontliners? Wala na, no? Wala na, 'di ba? Dito sa Davao, 'di ba? Wala din dito sa Davao, nakakairita. Kasi masaya din kasi pag may priority kasi parang feeling mo artista ka, feeling mo ang ganda-ganda mo, na feeling mo may silbi ka sa bayan, 'di ba? Yung parang excuse me, pipila lang kayo, ako diretso na ako sa counter na. Yun yung gusto ko na feeling eh. Kaya yan, yun din yung na-miss ko, no? And of course, na the beautiful na and the handsome faces na of my friends in Bicol, na-miss ko din talaga sila. I hope na pagbabalik na ang mga ano training, 'di ba? And yeah, yung mga lectures, makakabalik ulit ako sa ano sa Bicol. At gusto kong puntahan ulit yung sa may Sorsogon, yung villa, yung kila Heart Evangelista. Saan nga 'yon? Saan nga 'yan, ma'am? Yung mga ano, villa-villa sa may Sorsogon, yung parang where villa kay Meat Mountains, mga gano'n. 'Di ba? Yung parang may pool agad sa villa niyo. Sosyal kaya nun. Pero siyempre nilibre lang ako dati. Who am I to complain, 'di ba? So, ayun po, nag-enjoy talaga ako sobra diyan sa Bicol. Soon, makabalik ako diyan. And sige po, so we have when to start. 'Di ba, we usually start high quality chest compression only if unconscious si patient and not breathing, no pulse, and then breathing but only gasping. May nakikita kasi ako sa video sa Facebook, kino-compress niya ang babaeng nahimatay lang. Pag nahimatay lang po, that doesn't mean na wala siyang pulse, wala din po siyang breathing, 'di ba? Trip-trip niya lang mahimatay, no? Yung iba kasi sa atin, pag may natumba, ay wait lang, i-CPR ko agad 'to. Hala, kaya naalala ko talaga yung nangyari sa jeep, no, na videohan talaga siya. Na ano lang siya, guys, nag-pass out lang siya, kino-compress siya, tapos sabi niya, "Aray, aray, aray." Tapos sabi, "Hindi, kailangan ka namin i-compress." Diyos ko po. Ang sakit kaya nun, 'di ba? Yung pilit kang humihinga, tapos siya naman pilit kang kino-compress. Diyos ko. Again ha, sana hindi po mangyari sa atin yon. Kung alam talaga nating walang pulse ang client, 'di ba? And negative breathing, that's the time you're going to perform high quality chest compression. Kung alam mo namang nag-faint lang 'yan, Diyos ko, itaas mo lang ang legs, na why? O ito naman, basic 'di ba na mga basic po na mga 'di ba yung sa mga Red Cross natin, na let's say pag may nahimatay, first aid po, 'di ba pag may nahimatay, guys, you simply elevate the legs of the client. Kasi nagvasodilation eh. Lahat ng mga dugo sa heart niya papunta sa legs niya. So anong gagawin po natin? You simply elevate the legs of the patient Wag po nating paypayan kasi yung iba, minsan nawawala yung pagiging nurse at saka pagiging doctor din natin pag family na po, 'di ba? Ang ang pang victim, yung tipong pinapaypayan mo na lang, 'di ba paypay? Wala pong benefit yung paypay, but instead you need to elevate the legs of the patient and okay na po si patient. Wag po natin siyang pagpiestahan kasi ang dami naman talaga mga chismosa eh. Yung mga chismosa naman talaga yung mga pinaka-problema natin eh, 'di ba? Pag may friend ka dati nung college, pag nahimatay, buntis agad. Hala, grabe siya oh. And pag nahimatay, buntis. Siyempre malalaman mo talaga pag buntis yan. Number one, mawawala sa group chat nyo. Magli-leave sa group chat. Tapos magulat ka mag-online selling. Charot. Yun yung mga signs. Buntis po ang ating friend. Sige pa, so we have here the stop. When are we going to stop high quality chest compression? Of course, I have my own mnemonic here known as the stops also. Ayan. Ayan. So stops din ang mnemonic ko. So first things first is that we need to stop high quality chest compression if there will be a spontaneous return of circulation. If there will be a spontaneous return of circulation, guys, known as the ROSC. ROSC kasi means return of spontaneous circulation eh. Ulitin ko ha. Lagyan mo lang ng R, it's return of spontaneous circulation. Sir, ano ba mga example ng spontaneous return of spontaneous circulation? Number one, pag may pulse rate na si patient natin. Next, we have the RR. Next, we have the BP of the patient. This R, the signs na po na okay, na buhay po ang patient natin. Ayan, may return of spontaneous circulation na po siya. Check the pulse rate, check the RR, and then we have the BP of the patient. And then next, we have the PET CO2, the PET value, and the PET CO2, or the partial end tidal of your carbon dioxide, or the PET CO2. Ayan, next, aside from that, we have the letter T. I-read ko na lang ha. Ayan, we have your letter. Ayan, letter T po natin. Turnover. Ayan, 2911. Guys, pag sinabi po natin turnover 2911, kasi nag-activate kasi tayo ng emergency response system. So pag nag-activate ka ng emergency response, meaning nag-activate ka ng code or nag-activate ka rin ng ng 911 po natin. Sila kasi yung emergency response system. So matanong ko lang, pag sasabihin ko you dial number, you call 911, anong number ng 911? Malamang 911 at hindi po hashtag 87,000. Jollibee delivery yon, 'di ba? Ibang emergency yon, guys, na. Ayan. So we have returned over to 911. Ibigay mo siya sa 911 na. Ayan, matanong ko lang, sa Bicol ba anong dinadial natin na number? Malamang walang Bantay Bata 163 na po. Ayan, syempre may mga 117 kayong dinadial. Pero ang alam ko kasi 911 is national na kasi siya na. Tapos sasabihin mo lang kung saan yung exact location niya tapos sila na magko-connect. I'm not sure. Pero kasi here in Davao, very active kasi yung 911 namin. Like grabe guys, no? My brother works at 911, no? For almost 5 years na. Maliit pa rin yung sweldo niya. Pero ayan, alam mo yung 'di ba may mga helicopter na sila, no? May mga bus na sila, may mga bombero pa sila. Ang ganda lang ng 911 dito sa sa Davao. Like parang pang states na talaga. Kaya if ever kung ang alam ko nung nagkaroon ng problem sa may Bicol area, dinayo talaga ng 911 din 'yon. All the way from Davao, na yung bagyo. And then we have this like problem sa Tacloban, na dinayo din talaga ng 911 Davao. Although hindi talaga ako like avid fan ng Duterte, na medyo nairita ako sa administration ngayon. I'm from Davao pero yeah, I really respect the opinion from Bicol, pero hindi ko love si Lenny ha. Hindi ko love si Lenny. Hindi ko rin love po si Duterte na ayan, although kamukha ko daw yung si Pulong, no yung yung pinakakuya na anak. Napagkakamalan ako guys, na lalo na pag nag-shades ako and all. Siguro kasi masyadong malapad yung mukha ko and all na. Ayan, kilala niyo ba yung niya, yung si Pulong, no yung niya na mayor na napatalsik na whatsoever. Vice mayor pala. And we have the turnover to 911 next po. Ayan, pero hindi talaga ako si Pulong, ako talaga si Inday Sara, na I am Inday Sara by heart. Ayan, we have our letter O. Ayan, na if ever kung may over-exhaustion po tayo. Ayan, over-exhaustion. Guys, kailan ba tayo nakaka-feel na overly exhausted tayo? Kailan? Pag-check mo, di ba, the scene is safe. Tapos pag, hey, ay, ex mo pala to. No? Pag ex mo ba, iko-compress mo? Depende sa sitwasyon. Na? Kung hiniwalayan ka, tapos love mo pa, for sure, iko-compress mo talaga yon. Pero yung sa ex mong punong-puno ka na, like ayaw mo na talaga, syempre, iko-compress mo rin kasi nurse ka eh. Doctor ka eh, 'di ba? Syempre, napagsumpaan po natin 'yan, 'di ba? Kahit ako din, iko-compress ko talaga yung ex ko, pero depende ex ko din. Kung ex number 1, number 2, na ayan, depende kasi yan. May degree kasi ng love talaga. Na? So yung si ex number 2, hindi, ayoko. Na? Pero si ex number 1, syempre we're still communicating. Na? Ayan, pero syempre, na? Ayan, so ayun po ha. So we have the overly exhausted. Ganito yan. Kasi if pagod na pagod ka, tapos magko-compress ka pa, aba, baka nabuhay mo si client. Binuhay mo si client, pero ikaw ang na-chorba. So, sino ang magko-compress sa'yo? Wala, te. Ikaw yung mare-rest in peace. Kaya kawawa naman yung ano, yung mga masteral natin, 'di ba? Yung mga degrees po natin, 'di ba? Kawawa naman tayo. Kaya kung pagod ka, meron ka pong right na pagod na ako. Char. Parang sa love lang, pagod na ako. Ayoko na. Ang lamig na ng relasyon natin. Ayoko na talaga na relate lang. relate eh na minsan kasi pag napupuno tayo, na parang ayaw na natin, na kasi sometimes, 'di ba, this is a reality. Ang love kasi nawawala yan. Pero ang kalandian, consistent yan. Kaya doon na lang ako sa pagiging malandi. Na at least naging consistent din naman ako. Kasi minsan ang love, minsan madali ako magsawa eh. Ewan ko ba, no? Hindi naman ako pretty pero ang bilis kong magsawa talaga. Siguro hanggang ano lang talaga ako, hanggang 2 years na. Pero umabot po ako ng 10 years sa aking ex na nurse. Yung sa doctor ko hanggang 1 year lang kami. 1 year lang kami naglolokohan na. Pero sa nurse ko talaga like yeah, 10 years kami and we're still friends. Na we're still friends. Kahit may jowa na ako, na friends pa rin kami ng 10 years ko. Ewan ko ba? Pero siguro kasi hindi talaga kami para sa isa't isa. Siguro friends lang. Pero hindi. Na iba din eh. So anyhow, we have our overexhaustion. Over. And pag pagod ka na, you stop it ha. Stop it. Ayan, next we have your letter P. Letter P na po tayo. Sa ating mga gwapong physicians dito, sana nga yung mga physicians po natin. Ayan, si Doc Yu at saka si Doc Batung. Ayan, yung mga lovely doctors po natin. Sino pa ba yung mga doctors po natin dito? Sige nga, i-check ko nga sa chat po natin. Ayan, may mga nagchat-chat kasi Ayan, ayun nga sila sila Doc Yu. Sino pa? Okay. Yeah, sila Doc Batung. Bakit walang ano yung iba? Bakit wala po silang mga titles na pasan na lang po ng mga titles po natin. Para kasi yun kasi yung mag-a-appear sa mga ano nyo, sa mga cards nyo po at saka sa certificates. Ayan, para malaman natin kung doctor, okay, or nurse po, 'di ba? Medtech, 'di ba? Ayan, sige. So we have your letter P if the physician assumes responsibility po. Assumes responsibility. Now, pag sinabi natin if the physician assumes responsibility, then the physician po will assume that the client is dead. Sila lang din po ang magde-declare na patay na si client. Magulat kapag si nursing aid, nag-declare po siya, time of death, magulat ka. Ayan, again ha, si physician lang po ang may karapatan na mag-declare na patay na si patient. Time of death, okay, 7:15. So physician assumes respond, ayan, civility. Ano nga yung mga signs of death natin? Recall nga tayo, si rigor, 'di ba? Rigor mortis. Sino pa? Si livor mortis. Ano pa? We have the algor mortis. Sino pa?